In this video, I'm going to share with you 45 facts about PTSD. 1. PTSD stands for Post-Traumatic Stress Disorder. 2. PTSD is a mental health disorder that can develop in people who have experienced or witnessed a traumatic event. 3. Traumatic events that can trigger PTSD include natural disasters, serious accidents, physical or sexual assault, war or combat, and other terrifying or life-threatening events. 4. PTSD was first recognized as a mental health disorder in 1980. 5. Before the diagnosis of PTSD, similar conditions were known as shell shock and combat fatigue. 6. PTSD is not just a problem for veterans or military personnel. It can affect anyone who has experienced a traumatic event. 7. The disorder can even be triggered by events that are not typically seen as traumatic, such as bullying or discrimination. 8. PTSD can affect people of all ages, genders, and backgrounds. 9. Symptoms can develop within days or weeks of a traumatic event, or they can take even months or years to appear. 10. Not everyone who experiences a traumatic event will develop PTSD. 11. According to the National Center for PTSD, about 7 to 8% of the US population will develop the disorder at some point in their lives. 12. PTSD is more common in women than in men. 13. Symptoms can be divided into 4 categories: re-experiencing, avoidance, negative changes in mood and cognition, and hyperarousal. 14. Re-experiencing symptoms can include flashbacks, nightmares, and intrusive thoughts about the traumatic event. 15. Avoidance symptoms can include avoiding people, places, or activities that remind the person of the traumatic event. 16. Negative changes in mood and cognition can include feelings of guilt or shame, loss of interest in activities, and difficulty remembering or talking about the traumatic event. 17. Hyperarousal symptoms can include irritability, angry outbursts, and feeling constantly on guard. 18. PTSD can be diagnosed by a mental health professional. 19. Treatment for PTSD can include therapy, medication, and support from friends and family. 20. The most effective types of therapy for PTSD are exposure therapy, cognitive behavioral therapy, and eye movement desensitization and reprocessing, or EMDR. 21. Medications commonly used to treat PTSD include antidepressants, anti-anxiety drugs, and prazosin, a drug used to treat nightmares. 22. PTSD can be treated successfully, and many people with PTSD are able to make a full recovery. 23. People with PTSD are at a higher risk of developing other mental health disorders, such as depression and anxiety. 24. PTSD can also increase a person's risk of physical health problems, such as heart disease and diabetes. 25. PTSD can have a significant impact on a person's life, including their relationships, work, and overall quality of life. 26. PTSD can be a chronic condition lasting for many years or even a lifetime. 27. PTSD can also be a temporary condition, with symptoms improving over time. 28. People with PTSD may experience relapses of symptoms, particularly during times of stress or when they're exposed to triggers that remind them of the traumatic event. 29. There are several risk factors for developing PTSD, including a history of trauma or abuse, a family history of mental illness, and a lack of social support. 30. The brain changes that occur in PTSD can affect memory, emotion regulation, and other cognitive processes. 31. People with PTSD may have a smaller hippocampus, a brain region involved in memory. 32. PTSD can affect a person's physical health, including their immune system and their risk of chronic pain. 33. PTSD can cause sleep disturbances, including insomnia and nightmares. 34. The disorder can also affect a person's ability to work or attend school. 35. PTSD can affect a person's ability to cope with stress. 36. PTSD can affect a person's ability to parent effectively. 37. The disorder can make it difficult for a person to enjoy life or feel positive emotions. 38. People with PTSD may feel isolated and disconnected from others. 39. PTSD can also increase a person's risk of self-harm and suicide. 40. PTSD can be a barrier for seeking treatment for other health problems. 41. PTSD can be stigmatizing, with some people believing that it is a sign of weakness or a lack of resilience. 42. Children with PTSD may have different symptoms than adults with the disorder, including bedwetting, separation anxiety, and difficulty sleeping. 43. It is scientifically proven that PTSD can be passed down through generations, with trauma experienced by one generation affecting the mental health of a future generation. 44. Education and awareness about PTSD can help reduce its stigma and increase access to treatment. 45. With proper treatment and support, people with PTSD can learn to manage their symptoms and lead fulfilling lives. To learn more about PTSD and other health conditions, you should check out the Lifey app. Lifey is 100% free and has thousands of vlogs you can't find anywhere else.